Now. Hello, my name is Inara Panjwani. I will be doing my head-to-toe assessment for fall 2025 with Dr. Beasley. I will now be scanning the room. Okay. For my assessment today, I will be inspecting the head, face, neck, throat, mouth, anterior chest, posterior chest, upper and lower extremities, and the abdomen. I will be looking at skin integrity, turgor, texture, color, edema, moisture, any scarring, bruising, lesions, or nevi. So to begin with the head, I'm inspecting the head, which is normocephalic and symmetric. The hair color is black, texture and distribution is normal. Upon palpation, there are no depressions, infestations, masses, or lesions. Did you have any tenderness? I will be palpating the temporal arteries. That's 2+. I will now be palpating the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I will now be assessing for TMJ. So open your mouth, close your mouth. Okay, there is no subluxation, crepitus, or tenderness. I will now be assessing for cranial nerve 5, the trigeminal nerve. With my hands over the masseter muscle, clench your jaw. Okay, good. Close your eyes and tell me where I'm touching.
Right cheek, chin, forehead, right cheek.
Okay, cranial nerve 5 is intact. Next is cranial nerve 7, the facial nerve. Can you smile, frown, puff your cheeks, pucker your lips, raise your eyebrows? Okay, cranial nerve 7 is intact. The face is equal. Moving on to the ears. The ears are in correct placement. I'm going to palpate the pinnae and tragus. There is no masses or abnormalities. I will be using my otoscope to look in both ears. I will be looking at the auditory canal and the temporal membrane. The auditory canal is clear, the temporal membrane is semi-transparent and pearly gray. Next, we'll be doing cranial nerve 8, which is the vestibulocochlear nerve. We will be performing 3 tests, starting with the whisper test. So cover the other ear. I'm gonna whisper 3 words and repeat them back to me. 1, 2, 3.
1, 2, 3.
And the other side.
5, 6, 7.
Okay, we will now be doing the Rin test. I'll be placing my tuning fork in the middle of your head. All right, tell me where you hear it best.
In the middle.
Okay, and now I'll be doing the Rin test. Tell me where you hear it best. In the first or second? Okay, great. Air conduction is greater than bone conduction. Cranial nerve 8 intact. Okay, next we will be moving on to the eyes. I will be inspecting the eyes, eyelashes, eyebrows, and palpable fissures. I will also be looking at the sclera, which is white, and the conjunctiva, which is the lining of the eye. No abnormalities noted. There's no lesions or discharge. I will now be looking at cranial nerve 2, which is the optic nerve, using my Snellen chart. So close one eye and read the lowest line.
LTFPH.
Okay, switch eyes.
Oh. LTFPH.
Okay, great. Again, cover one of your eyes and, all right, tell me which number you see.
2.
All right, switch eyes. Which number do you see?
4.
Great. Cranial nerve 2 is intact. Next, we're going to be assessing cranial nerve 3, the ocular motor nerve. I will be using my pen light. Okay, all right, look straight ahead. Okay. Look straight ahead. Okay. For pupillary constriction, pupils are round, reactive, and equal. Cranial nerve 3 is intact. I will be now looking at accommodation and convergence. So look at the wall behind me and follow my finger in and out and in and out. Great. Next, I'll be looking at pupils reacted equally to accommodation and convergence. Next, I'll be looking at cranial nerve 4, which is the trochlear nerve, and cranial nerve 6, which is abducens. So follow my finger in a snowflake pattern through the 6 peripheral fields. Okay, cranial nerve 4 and 6 is intact. I will now be using my ophthalmoscope to check for the red reflex and other internal eye structures. We're going to simulate dimming of the lights. Okay, the red reflex is present and symmetric. Okay, moving on to the nose. The nose is midline and straight. We are going to be testing for nasal patency. So plug one nostril and smell. All right, plug the other nostril, smell. Great. I will be, and that was for cranial nerve 1, olfactory nerve. And I will now be, which is intact, palpating the maxillary and frontal sinuses. Frontal, maxillary, great. No tenderness. Moving on to the throat and mouth, we will be inspecting the teeth, gums, buccal mucosa, floor of the mouth, palate, posterior pharynx, salivary ducts, tonsils, and the tongue. So I'll be shining my pen light in the mouth. Okay, say ah. All right, there's no abnormalities. Next we have cranial nerve 9 and 10, glossopharyngeal and vagus nerve. So stick out your tongue and say ah. All right, I'm looking for the uvula to rise up and down with phonation. Next is cranial nerve 12, the hypoglossal nerve. So stick out your tongue and say ah. All right, move your tongue up and down, side to side. Okay, there is no fasciculations and the tongue is midline. Cranial nerve 12 is intact. Okay, moving on to the neck. The neck is midline and straight. We will be assessing the trachea and the thyroid gland. So I will now be palpating the trachea. Okay, move your tongue to the left and to the right. Okay, now swallow. Okay, great. I will be palpating the carotid artery. Okay, it's 2+. Okay, I will now be auscultating the carotid artery with the bell of my stethoscope. Okay, hold your breath. All right, and hold your breath. Okay. No bruits were heard. Moving on, we're going to start with the posterior chest. Before we do that, I'll be looking for any signs and symptoms of respiratory distress. I'm looking for any use of accessory muscles, retractions, nasal flaring, tripod positioning, retractions, or any cyanosis or tachypnea. None are present, so I'll ask you to turn around with your knees up on the couch. Yeah, so that the camera can see your back. Yeah, you can turn around. Okay, that's good. Thank you. I'm looking for any deformities. There are none present. So I will start by palpating the chest for chest expansion. So breathe in and out. Chest expansion is symmetric. I will now be looking for tactile firmitis. So every time you feel my hand, say 99.
99.
Okay. Vibrations were present throughout. I will now percuss over the lung fields. Okay. Resonance was heard throughout. I'm now going to auscultate the lung sounds. Okay, I will now be auscultating for egophony by saying E and bronchophony by saying 99, and then whisper pectoralque by whispering 99. Okay, so every time you feel my stethoscope, say E.
E.
Okay, say 99.
99.
Okay, now whisper 99. Okay. All right, you can face me now. Okay, now we're going to be looking at the anterior chest. So again, I will be palpating for chest expansion and tactile firmitis. So breathe in, breathe out. Chest expansion is equal and symmetric. I will now be palpating for tactile firmitis. So say 99.
99.
Okay, vibrations were heard throughout. I will now be auscultating over the anterior lung fields. Okay. All right, so now we're gonna move on to the heart. So I will be auscultating with the bell and diaphragm both, the 5 points, which is aortic, pulmonic, Erb's point, mitral, and tricuspid. Okay, now switching to my bell. Okay. I will now be palpating the PMI, which is in the 5th intercostal space. And I will be auscultating the apical pulse, and we're going to simulate 60 seconds. Okay, the rate is regular, the rhythm is regular, and the rate is 70. Okay, so we're going to have you lie down now at a 30 to 45 degree angle. I'm just gonna check the camera, making sure we can still see. Okay. All right. So I'm assessing for JVD, distension, and pulsation. So upon palpation, there are no thrills, and there are no lifts or heaves noted. I will be now auscultating and palpating all the 5 points. So first I'll palpate all the 5 points for any thrills. Okay, there are no thrills noted. I will now auscultate again. Aortic, pulmonic, Erb's point, mitral, and tricuspid. Tricuspid and then mitral. Okay, I will now be moving on to the abdomen. So I am inspecting the abdomen for contour and symmetry. The abdomen is within normal limits, it's symmetric. I will begin by auscultating with the bell of my stethoscope the aorta, renal arteries, iliac arteries, and the femoral arteries. Okay. And then I'm going to, there were no bruits heard, and I will now be auscultating with my diaphragm on my stethoscope all the 4 quadrants for vowel sounds. Okay, vowel sounds are normal, active, and present. I will now be percussing all the 4 quadrants. Okay. There was tympany heard throughout and dullness over the organs. Now I'll be palpating. Do you have any tenderness? Okay. And no masses were felt. I will now be palpating the liver and the spleen. Hold your breath. Okay. The liver and spleen were both non-palpable. Okay, you can sit up now. I will be assessing for CVA tenderness. All right, no CVA tenderness was noted. Moving on to musculoskeletal, we will be inspecting the upper extremities. We will be looking at fingers, hands, wrists, elbows, shoulder. And I'm looking for any redness, swelling, any deformities, any edema, moisture, the temperature, any tenderness, nodules. So the skin is warm to touch and there is no edema present. I will be looking at cap refill on all the fingers. Okay, it's less than 3 seconds. Now I'll be assessing the radial pulse. Okay, the rate is 70. We will start by assessing the range of motion in the fingers. So follow me. Flex, extend, hyperextend. Now abduct and then adduct. All right. Now moving on to the wrists. So flex, push down, extend, hyperextend, all right, and rotate. All right, we're gonna do ulnar deviation, so inwards, rotate your wrists inwards, yeah, and then radial deviation is outwards. Okay, like this, yeah, there you go. Next, we're gonna be doing range of motion in our elbows. So flex up, extend, and then hyperextend. Great. Next, we're gonna do range of motion in the shoulders. So flex, arms straight, extend, and then hyperextend with the back. Good. And then have your arms out like this. Okay, so that's abduct, and then back to your body is adduct, and then circumduction, so round. Okay, great. Now we're gonna assess strength. So squeeze my hands. Okay, finger strength and hand grip is 5 out of 5. Now we're gonna do strength in the bicep. So push against me, all right, and the tricep, all right. That strength is 5 out of 5. Now we're gonna do the shoulder girdle. So have your arms out in a T shape, all right, and push up against me. Good, strength is 5 out of 5. Next we have cranial nerve 11. That's the accessory nerve. So shrug your shoulders against resistance. Great. Cranial nerve 11 is intact. Then we have, we're gonna do rapid alternating movements to assess cerebellar coordination. So put your hands on your thighs and just go in and out fast. Great. And then touch your thumb to all the fingers. Okay, great. And then touch your foot to your hand. Yep, all right. So that's cerebellar coordination. Also for the fingers range of motion, we forgot thumb opposition, so do touch your thumb with your index and then pinky. Yes, thank you. And then we're gonna assess diagnosis and graphesthesia. So close your eyes, and then what have I placed in your hand?
Cup.
Okay, and now I'm gonna draw something in your hand. What did I draw?
8.
Good. Okay, next we are going to we're going to assess the light touch. So close your eyes and tell me where I'm touching.
Forearm.
Okay.
Shin.
Okay. And then the skin integrity, it's warm. The skin is warm to touch and there's no edema present. Next, we're going to talk about, we're going to assess the vibratory sensation. So I'm going to use my tuning fork. So we're going to do it on the ulnar sides. Okay. And then inner ankle. You feel that? Okay. Next, we will be looking at our reflexes. So we have brachioradialis, biceps, triceps, patellar, inner ankles, and then Babinski. Okay. All right, all reflexes are present. We're gonna move on to the lower extremities. So I'm going to be inspecting the toes, ankles, knees, and hips. Again, I'm looking for any redness, swelling, edema, scarring, bruising, or any lesions, crepitus, or any tenderness. Everything looks within normal limits. I'll be assessing the cap refill in all the toes. All right, it's less than 3 seconds. Now I'll be assessing the pulses, dorsalis pedis and posterior tibial. Okay, pulses are present. We're gonna start with range of motion of the toes. So follow me, flex, curl your toes inwards, extend, and then hyperextend. All right, abduct out and adduct in. Okay, next we're gonna do our ankles. So dorsiflexion up towards the sky, plantar flexion down, yep, inversion, and then eversion outward, and then rotate each ankle. Great. Now we're gonna assess range of motion in the ankles. So push your feet against me, up, all right, and then down, good. And then we're gonna do range of motions. Strength was 5 out of 5. We are gonna do range of motions against the knee. So push up against me, push your legs up. All right, now push them down. Great. Okay, strength is 5 out of 5, and I'll have you stand up now. Okay, so we're gonna do strength on the hips. So push your leg out, okay, and then leg out. Great. Strength is 5 out of 5. All right, we're gonna do range of motion to the hips. So flex, extend, and then hyperextend. All right, now the other leg. Flex, extend, hyperextend. All right, now abduct out, and then adduct was in, and then the other side, abduct out and adduct was in. And now circumduction, so rotate both the hips. Okay, great. We're gonna do the knees. So pull your foot up, flex, extend, and then hyperextend back. All right, and both legs. So up, extend, and hyperextend. Okay, great. Now I'm gonna have you turn to the side. Yep. And I'm looking at the spine. I'm looking for alignment, curvature, and any tenderness. Now bend downwards. All right, move back a little bit. Yeah, now bend downwards. There is no scoliosis present. All right, you can stand up again. Shoulders are symmetric as well. So so that was extend. Now lean back, that's hyperextend, and lateral flex is side to side. Okay, and now rotate. Good. Next, we're gonna do range of motion of the neck. So look down, look up, Okay, and look straight and then side to side. All right, and then rotate. Great. We're gonna do the Romberg test, so hands out in a T shape. All right, close your eyes. There's no sway present. Lastly, we're gonna do gait. So we're gonna walk heel to toe. Yep, great. And then hop on one foot. Yep, and switch. Okay, so the gait is regular. Thank you, that completes my head to toe assessment.